This is Joost Daemen from the Thoraxcenter in Rotterdam. So current guidelines for the current revascularization guidelines recommend the use of coronary physiology in case of intermediate coronary artery lesions in the absence of non-invasive ischemia testing. In the US, these guidelines are actually restricted to wire-based physiology using either FFR or non-hyperemic indices like IFR. But what is interesting is that in the European guidelines, also QFR recently has been added as an alternative to FFR or IFR to guide coronary revascularization. And for those of you who are not familiar, so QFR is a angio-based physiological index that allows computation of physiology using angiograms only. So vFFR is actually also a angio-based physiological tool that allows you for instant online physiological lesion assessment in patients with intermediate coronary artery disease. And the big advantage of vFFR is that it does not need or does not mandate the use of guiding catheters. There is no need for invasive coronary artery instrumentation, and there is no need for hyperemic agents, which makes this technology actually somewhat more readily applicable, easier, and perhaps also safer to use as compared to the conventional wire-based technologies. So to me, the biggest value of angio-based physiology with vFFR in particular, again, is that it does not mandate the use of invasive coronary artery instrumentation. It doesn't mandate the use of coronary wires with potential risks. And there's no need for hyperemic agents which really enhance or improve the potential for side effects with the individual patient. So with that, you save time, you potentially save complications, and as this technology has been widely validated, both preclinically as well as now in a large-scale outcome trial, this technology allows for a simpler and faster physiological lesion assessment as compared to the conventional wire-based technologies. So if you get this technology readily available in your cath lab, the only thing you need to do is to set up an instant DICOM connection from your big iron onto the Cath computer, so basically which can be any workstation within your cath lab, so there's no need for a car to be driven into the lab. It's just a simple piece of software that can be installed into any computer in the tech room in the cath lab. And with that, you get your images connected basically instantaneously from your X-ray device into the Cath computer, which would allow you with 2 orthogonal angiographic projections to get a online vFFR assessment within the matter of 1 to 2 minutes. The only thing you need is the aortic root pressure as a boundary in that condition in order for the system to process the computations in order to give you the online vFFR assessment. So if you do believe in physiology, if you want to follow the guidelines and implement the use of coronary physiology in patients with intermediate coronary artery lesions, I do believe that angio-based physiology with vFFR in particular is a very appealing technology that allows you to simplify the physiological lesion assessment process without the need for invasive coronary artery instrumentation, without the need for a guiding catheter, and without the need for hyperemic agents, allowing you to do physiological lesion assessment simpler, faster, and potentially even safer as compared to the wire-based technologies.